Hey, this is Pony Moore from the NiuOla podcast. And today I'm excited to introduce an extraordinary guest, an individual who's shaping the healthcare landscape. Today we're thrilled to introduce Dr. Tui Lauilefue. With her diverse background, spanning academic, corporate, and direct primary care settings, Dr. Tui is a compassionate and dedicated physician committed to elevating healthcare standards. She is a double certified in internal medicine and obesity medicine, having completed her internship and residency training at the John A. Burns School of Medicine in the University of Hawaii at Manoa. Dr. Tui brings a wealth of knowledge and genuine commitment to personalized care. Join us as we dive into with Dr. Tui's journey, her passions for patients' well-being, and the remarkable impact she's been making in the field of medicine. And if you like what you see, please leave a comment, share, and subscribe. It only makes us better. Enjoy.
Why, tell me why the sky's blue. Tell me why this money is green. Now Lord, please, tell me why I do these things to make tea. Now yell at me. They kick me out of church, cause I just don't listen. Always fall asleep when the preacher is preaching. Not my fault, I do love God, but on Saturday nights I be all up on God.
We are back again to NiuOla's podcast. Again, the #1 podcast that helps you pass time. And how do we do that? By inviting folks like this amazing woman right here that's sitting next to me, Dr. Tui, to go ahead and share her experience and also to motivate and inspire our youth, you know what I'm saying? And even us OGs that are listening and tuning in. Dr. Tui, man, I just want to thank you. Thank you so much for, giving this time to come onto our platform, you know what I'm saying? Because
thank you for having me.
You're welcome. You're welcome. The honor is ours. And I have a few questions to ask, but before we do that, to the listeners who are not familiar with Dr. Tui, you need to go check out Behind the Lavalava. Shout out to my man, Michael Tan. That man right there, because he pretty much breaks down your credentials and your academics. So anything that has to do with your professional stuff like that, if you need more, if NiuOla forgets to put it on there, Behind the Lavalava has a lot of that information on her background, but we're gonna do our best to cover. So I want to fast forward real quick, like I was saying offline, Dr. Tui, is that what caught me on your interview with Michael Tang, you mentioned something that you was, when you got into the University of Hawaii and you were going to your classes, you wanted, you were asking your advisor on the medical side, and that person kind of like was shocked because they just automatically assumed that you weren't the type that fit this particular profession. To me, can you go ahead and get more into talk to us about that? Because to me, I feel like a lot of our Polynesian people go through stuff like that when it's something out of our realm.
No, I mean, that is definitely something that I'm more than happy to share. And I'm sure I'm not the only one that's happened to. I'm sure that a lot of us, once we're kind of outside of our element, outside of our usual environment, especially for people like you and me who, we grew up in American Samoa or back on the islands, and then we leave the island, and it's a very, very kind of different environment, different situation. So, but for me, so when I left American Samoa back in 2002, again, I was in Hawaii. I was at the University of Hawaii. And so that time that I went in to see that counselor, it was really shocking to me because, I was just used to seeing our own, teachers, counselors, everybody or majority of the people that look like us, but very different setting, right? It was like we came from somewhere where we were the majority and into a different environment where we were no longer the majority, right? More the minority. But in Hawaii specifically, I mean, there's such a big mix of people. But going back to that day, so it was one of the examples, right? So I had gone in, and then my counselor was there, and I really wanted to to let him know that these are all the classes I wanted to take, and I know that I want to do medicine, and I know that this is the track for me. But again, when he looked through the number of classes, and not just the number, but the type of classes that I was looking and hoping to get into, I just got the impression that he didn't feel like someone like me, and maybe it was just my name and the way that I looked. Someone like me wouldn't be able to do it, right? So again, I was very, very disappointed, and again, and shocked at the same time. Again, this is me just kind of, fresh out of Samoa, going to school in this new place all on my own, and then experiencing this. I mean, sure, I've heard it from other people, but experiencing it firsthand was definitely a different kind of experience. So, but took it in stride, and I didn't want to let that get to me, right? So, like this is just one person's opinion. I don't want to let this person determine the course of my life, but he was in that very, like, he played a very pivotal role as far as saying yes or no, you can take these classes. But because he could have just said no, I don't think you can handle this. I think this is too much for your coursework. You just started here. I think you need to go, maybe take a little bit easier load. So I could have just said, okay, well, sure. And then, where would I be now? I don't know. I don't know, but that was one of the examples. I mean, there are a lot of other things that I had to kind of go through when I was going through training in Hawaii, right? And if you think about Hawaii, there's so many Samoans in Hawaii already. So thinking about Pacific Islanders growing up in other places where we really are the minority there is even, I can't even wrap my head around it, what kind of experiences people will have from that kind of situation.
Now, you said he held a position that it was going to allow you to take these classes. Can you mind me explaining that to us, the coconuts that did not decide to go to college and stuff like that? What do you mean by that? To me, I just took it like it's a gatekeeper, in the media world. But what do you?
No, so he was. So depending on your major, so I was a biology major, because if you wanted to do certain tracks, and for me it was the pre-medicine, right, pre-med track, because eventually I need to take very specific courses, mostly science courses, in order to qualify to get into med school, right? So they have a list of classes or prerequisites that we would have to take before we would even be considered for admission into med school. So he was one of those advisors, right, for biology. And he would have to sign off on the courses before we would even be allowed to take them, that kind of thing. I guess we could go ahead and just do it, but really it was without his blessing. It was my impression. I wouldn't have been able to take the courses that I wanted to take.
Wow, that's interesting. And I know you mentioned it on Behind the Lavalava, but also exactly where did you get all this inspiration from? And how were you able to even know what classes and courses to take? Because like I said, I've never, well, at least me personally, I haven't met any other doctor that's from Samoa, and the fact that you went, I know a lot of nurses and a lot of different specialist practices, but not an actual certified doctor. Where did that inspiration come from? Like, I'm like in awe, like, dude, where'd you get that from? From in local Makey, White Sunday, we do nothing but skits. I mean, you get what I'm saying? Like, you are in Coco Land. It's like, where did
I'm
that
your neighbor, just
That's what I'm saying.
Famaima, and then you go a little bit
Yeah.
further, and it's Coco Land right there.
That's what I'm saying. And we didn't have a lot going on besides cricket. Was one of the village was like good known for in Famaima, but in Coco Land, it's like, what inspired you and where did you get all this inspiration and just the knowledge to even think that ahead of like, oh, this is what I gotta do,
I think I just got lucky. It's a lot of it was just from my family, right? Those values that were just instilled in me, not just me, but I have three brothers, right? So there's a total of four of us. My parents were both educators, so I found that to be an advantage just going through school in American Samoa. My dad was an English teacher at the time, so he
Mm,
originally was from Western Samoa, now known as Samoa. But he taught English there, and then he went on to go to school in New Zealand. So he did college there in order to mainly look at curriculum studies, right? So he then moved to American Samoa, worked for the Department of Education, where he did a lot of curriculum development for our public education system back in Samoa. So
nice.
meanwhile, while he was doing all of that, my mom was a public school librarian all her life in Samoa.
Wow.
So in my household, I always grew up around books because I was the only girl, and I know a lot of you, someone females growing up there can relate to this. I wasn't really allowed to kind of go anywhere else other than go to school, come back home, or after school, just go hang out with mom at the library. And while I
Mm,
was waiting for her to get off, right? I mean, there was nothing else to do. That was the time before technology was so rampant, right? Nobody had a phone. No one had access to a computer. I don't even think I learned how to type until I was in high school. And we learned on those old school typewriters where you would have to like do the
yeah.
thing and then the paper would move down. So that's how I learned to type. We had keyboarding. We didn't even have computer classes at the time. But again, because I think I came from that background where both parents were educators, they put a lot of emphasis on education, on the importance of education. And I know growing up on the rock, there are only few ways to kind of leave the rock, right? So either you get some kind of scholarship through
Yep.
academics,
Yes.
um, go the military route. My dad was in the military. I have two brothers in the military, one Army, one Air Force. So I was thinking about that too, but really my dad just would not let me go the military route. Or you could get like a sports scholarship, and I have like zero athletic bones in my body. So I just had to read books, that was my ticket out of there. Yeah, so I think a lot of it really just came from my upbringing, right? And a lot of it from my parents. But when I got to Hawaii, it was kind of hard to navigate because I didn't have that support like I did back in American
Yes.
Samoa. So, but I was fortunate because in Hawaii we do have these Samoan, groups, different organizations. We had the Poly Club at the time. But I had, people that I already knew from back home that were already in school there, right? So they kind of helped me navigate course catalog, navigate like, okay, so you want to do this route. So these are the classes that you may need to take. So I think I was just fortunate because I already had some connections to the people who were already there instead of me just showing up and then having no idea what I was in store for. So
And then when you got to Hawaii and you were going to school, you already had your mindset. Like what in that time zone, when did you decide I'm going to be a doctor?
I think I decided from a young age. So
Oh, so
even,
you already, this is all before even like high school.
oh yeah, I think from a young age, and I'm sure you've seen it too. I mean, growing up in American Samoa, it's so hard to see what happens to our people, right? To our loved ones, and seeing how advanced disease can be. And a lot of it really came from visiting because a lot of summers I would spend in Upolu with my dad's family and
Mm,
my grandma that was there. I think a lot of that inspiration came from grandma, just seeing how sick she was. She already had like pretty advanced diabetes. She wasn't a big believer in Western medicine. She would go and see the fufu, for example.
mm,
And then she lost her eyesight to diabetes. Before it really, got to the rest of her system. So that was something that I thought as a young child, like, hey, if I could do something to help not just grandma, but just, the people that we grew up with, the people that we know. And if I could better myself, or if I could get to a point where I could be in a role like a physician, where I'm then able to kind of give back and have some kind of impact in society, then that's what I want to do. So
all the
yeah, I never
inspiration came from the family.
Oh yeah, from the family for sure. I mean, there was never like a clear path. It was more
Hmm.
like on the go. It was more like, okay, so this is what I have to do now to get to that next step, and then after that, and then what do I have to do next, kind of thing. It's hard to kind of plan for things long term, but that was always the goal. That was always the goal, though, to eventually become a doctor.
Yeah, man. First of all, I'm gonna go ahead and drop a file on your grandma, your dad, and your two brothers who
Oh,
served our country, yo. Thank you so much.
there you go.
Yes, go. Man,
Thank
that's inspiring. That's really inspiring. And it makes a lot of sense now. Now I'm starting to understand why you ended up going that route. And real quick, because you said your grandma didn't believe in the Western medicine, and that's so true because I can relate to that. I was in Samoa at the time you were there, and a lot of these before Samoa in America, they call that witchcraft. Like how the what is it, Jamaicans and everybody else that like they believe in the healing from nature. Do you,
you.
did that ever come up in the Western study since you've been studying in medical and stuff? You know how they believe the plants and stuff with that for full somebody has a swollen leg. Does any of that like play a part, or what's your thought on, or just your own personal opinion?
Yeah, no, that's a great question because I mean, I never really looked at it as like witchcraft as some people will look at
Mm-hmm.
that, because going through my training, most of the things that we did in Samoa when it comes to traditional medicine, um, you know, that was really never the mainstay of therapy, meaning like, the first line, for example. But if you really look at a lot of the studies, the way that they look at it would be, well, let's research the evidence. Is there any good evidence that this works? And, what about these plants? And so, but it was never that emphasized. Like when we would see patients,
Mm-hmm.
we were taught to kind of ask very specific questions, make the diagnosis, come up with a treatment plan, but the treatment plan would never include things that we emphasize in more like traditional medicine kind of world. We would do more like FDA approved medications, for example. But when I was practicing in Hawaii, I had patients who were Samoan, I had patients who were Micronesian, right, who would come and they would be on certain, not medications, but like certain herbs, supplements, vitamins, that
Mm-hmm.
kind of thing. So I think for me, because of my background, I always just was more open-minded when it
Open-minded.
comes
Yep,
to
it
things
makes
like that.
sense.
Yeah, because I mean, as a doctor, we could advise all we want, right? And we could tell them, oh, no, you got to take Tylenol and this and that. But at the end of the day, if your patient doesn't have that rapport with you, if they're not going to feel comfortable, they're going to do what they're going to do at the end of the day, right? So for me, it's like I want to get to a point where I know the patient trusts me enough to let me know that, hey, I know you didn't recommend this, but this is what I'm taking. Like these are all the different things that I am taking. That way I can at least run an interaction check and make sure that that that's something safe that they can take, right? So I'd rather have patients tell me that they're taking it, but I don't want to chastise anybody for just taking something that they've always believed in or that, they've always taken growing up.
And then, Doctor, what is your take with our Polynesians? Because I feel like I don't know, I could be wrong. Our Polynesians clients, are they afraid to just come up to the hospital because of their lack of knowledge? Like a lot of our family members that at least around my circle, somebody can
Mhm.
have gout or somebody can be sick, and they decide they figure they could just sleep it off or just rely on God for healing because of the lack of finance. So a lot of people will just kind of like, you know, duke it out and hope for the best. And that's what causes a lot of our Polynesian people to pass away, unfortunately. My question
They
is, the percentage wise, have you seen like an increase of, since you've been in the medical field of like, our Polynesian people are getting, I feel like people are getting educated. They're starting to take that, that step, but has it changed increasingly? I mean, what is your take on that?
Yeah, No, you're exactly right. So I saw that even in training. I mean, even before training, even when I was in Samoa, right? Just growing up, and I'm sure you've seen it too. And I don't know if it's because of the way that our medical system is kind of set up back home. I think it's better now for sure, but when the way that I saw it, or the way that I had observed it, was, people really wouldn't go to the hospital until things were so advanced, right? It was like sometimes even near death. And then by then
Yes.
it's, oh, it's already too late. You should have presented like maybe a year ago or so. But I feel like that's also a public health kind of crisis.
Mm,
If we are not, if we as a society don't put enough emphasis on prevention, right, on seeking more primary care services
yes.
versus just showing up to the emergency room. I mean, so many of the chronic diseases that we suffer from are things that could have been addressed if they were caught and diagnosed and treated early on in the disease state versus just let it go on and on. Because by then, if things are so advanced, it's like, oh no, you already need dialysis. Your blood sugars have been high for so long, it's already affected the kidneys. So I think if there was more an emphasis in prevention, right, getting people to go in for their annuals, for their routine screening, for their wellness visits, a lot of those things could have been caught maybe, and then that way you already have a plan before letting things progress. But you're right. So I mean, growing up in Samoa, I could see how a lot of people would just be, kind of trained to do that. Like, oh, I'll just go to the emergency room when I feel really sick. But then moving off island, going to Hawaii, and then seeing people there, a lot of that was the same. And like you said, I don't know if it's just another thing that I've heard from patients is they're not comfortable seeing providers who are not necessarily from their background,
Yeah.
or seeing providers who are non-Samoan. But depending on the provider, I mean, there are a lot of great providers out there, but there are also providers that they just can't relate to, or patients feel like they're not being heard,
Yes.
and it's not
Mhm.
even just like a language barrier. It's more, it's they just can't relate. um, and some of that comes from the system too, right? So I feel like healthcare as it is right now, modern healthcare, like so many doctors are very pressed for time. I feel like it's a lot more like so much bureaucratic burden, right? So it's making it really hard for doctors to just focus on patient care. So a lot of them are pressed for time, they're rushing, and I don't know if because they're going through that, the patients are definitely seeing it, the patients are feeling it, that they're not getting the time that they deserve. And then if you think about it, and then you see
Yeah.
a patient who's from a completely different background, so that there's going to be even more of a disconnect when it comes to being able to establish rapport and build that connection and relationship with your patient, because you need to kind of get to that point with your patient before they can even trust you, before they can even listen to your recommendations. So for people of our background, like I feel like a lot of us, we need that kind of relatable factor to be in play before we can really comfortably and consistently see your doctor. So
Yeah, you're absolutely right. I think a lot of it has to do with yeah, with the culture and the fact that we're not comfortable. I'm saying where because I am a product of that.
mhm,
Uh, I'm I'm type 2 diabetic. I,
mhm,
I had a minor heart attack last year,
mhm,
and like you said, all of that could have been prevented if I was to go, if it was something that I was so used to doing. Like
mhm,
I didn't know any better. I was That's why I asked that question because now I care about my health. And even I think it was last year or a year before, I even went to one of these weight loss,
mhm,
and they gave me these medicines. I'm sorry, I'm not good with names of medical terms or the medicine, but it's where I took those medicine and I wasn't hungry. So it did help to cut off the craving.
mhm,
But the reason why I failed on it because I feel like muscle memory. was so used to eating all the time that it
Mhm.
overpowered. Even though I wasn't hungry, I just knew like, hey, I gotta eat because it's just the time I normally have to eat. So,
Mhm.
long story short, I fell off the wagon. I did try out that service because I wanted to lose the weight. I did not like that. I was told that I was, type 2 diabetic and stuff like that, which then led me to get that heart attack. And yeah, just you saying the right things. I think the answer is we got to have a lot of more Polynesian doctors out there so our people can see that and get educated as a community. That's great.
Mhm.
That's good. I like
There's
it.
a couple of us out there, you know.
Yeah, but like you said, like in a bigger volume to where people can the community
Yeah,
can
it's the visibility
the
that's the problem.
visibility. Yeah, because I was telling my family about you, and there's a lot of them in Seattle and Tacoma. So they started looking you up. They're like,
Oh,
oh, maybe I should
yeah.
go out and
Have
her.
them come out.
Yeah. So you're gonna see
Telling
a
you.
lot of them. Yeah, they are. They're looking you up. And you're speaking of your clinic, man. Let's get right to it. I know you got time. Yeah. Well, let me finish this up because I know you're a busy person. But yeah, what is your business? I know for the listener, Doctor, she used to treat 2 to 3,000 patients, and she went down to independent, doing her own thing, and now she's only treating her own private people patients about 2 to 300. Man, that's
Mhm.
amazing. Congratulations to you.
Thank you.
Let my people, the Wide East listeners, educate them about that because some of us coconut don't even know that you can even go to, a private clinic, to see somebody.
Yeah, so it's called NiuOla Health. We rebranded just this year, and it's a very small clinic. So it's just me and my one medical assistant, and she's also the office manager, and she's also the front desk person.
Wow.
So she kind of wears all the hats, but it's just the two of
Superstar.
us in this clinic. Oh yeah, she does everything. She's amazing. But yeah, no, we private practice, right? So we keep our panel very small, but that also allows us to, be available for our patients because,
Mhm.
like you had mentioned, in the corporate medicine world, like if you go to your traditional clinic, they take your insurance, you go in, like it's so hard to even get an appointment to see people, right? If you're trying to get in, you have to wait a couple weeks, sometimes even months. If you need to get a medication refill, you call them. It's like you can never talk to your doctor directly, right? You have to go through like some call center, front desk, maybe leave messages for the medical assistant or the nurse or whoever it is. But the way that our clinic is set up, so it's called a direct primary care model. So
Mhm.
this just means that the relationship is just between the patient and the doctor, and then that's it. And that's why we don't take insurance either, because they're kind of like a third party. And when insurance is in play, it really makes it hard to practice medicine just to, it really makes it hard to practice medicine and put the patient first. Because when insurance companies are involved, like we have to practice medicine in a certain way that satisfies the insurance's criteria, right? And that may
Wow.
not always be in the patient's best interest, in the patient's best interest.
Wow.
So it's more like a membership model that we run. It's every month. But the patients like it because when they need to see us, they can pretty much see us today or the next day. They don't have to wait a long time. When they come into our office, we're able to see them right away. They don't have to like hang out in the waiting room for a long time because we only have a small patient panel. They can text me, call me, email me directly without having to go through like a front desk or, just last week I had a couple of patients, right? Somebody had messaged me, he had messaged me saying that, hey, I just had dinner 30 minutes ago, but now I'm having trouble with my arm. Like my arm feels very, very heavy,
Mm.
but what should I do? Maybe I'll just wait it out. And then I got the message. I'm like, no, don't wait it out. You might be having a stroke. You need to go to the emergency room right now. So if my patient was in the traditional model, if he would have sent that message, nobody would have gotten it. And I know my patient, he's like an older gentleman, like he hates going into the emergency room. He's very stubborn. He would have stayed home, stroked out, and then that would not have been a good outcome. But because he was able to reach me directly, I was able to tell him, like, hey, listen, go to the emergency room. You can't drive, have your wife drive you. If nobody can drive, just call 911 so the ambulance can come and take you. So it's things like that. That's why I really like this model, because patients, again, they're able to kind of reach me directly. It's kind of like having a doctor in the family or in your back pocket, right? So
Mm,
kind of like on speed dial. Yeah.
damn. And is it just obesity your practice, or is it other stuff like mental health? Any
Mhm.
other, do you do surgery too and stuff like that?
Oh, so I'm great question. So I'm board certified in internal medicine and obesity medicine. Majority of my practice is actually internal medicine. So I'm an outpatient doctor. I do mostly just primary care. I have a brick and mortar. Weight loss is something I only started doing recently.
Mhm.
So that's a smaller part of the practice. But again, majority of it is primary care. Not a surgeon. I did not do well during my surgery rotation. I threw up a lot when we would go and look at wounds. So then I remember my upper level told me, like, hey, I hope you don't want to go into surgery because you're going to be a terrible surgeon if you keep throwing up in the patient's trash can. So no surgery for me. So just internal medicine, obesity medicine.
And doc, this is me being a coconut. What is eternal medicine?
Internal medicine. So so 4 years of medical school, and then you do like an intern year, and then you do residency. So the total is 3 years. With internal medicine, so that means I see mainly adults, right, or only adults, so 18 and older. And then I'm the one that you get to see when pretty much for anything. So I'm kind of like the
Nice.
first line. Um, so I could have become a hospitalist, meaning, so there are two main routes, right? So you either work in the outpatient setting, like in the clinic, where if you need like your primary care provider, I'll be the person to see. A lot of people that I trained with decided to go the hospitalist route. So those are the people who only see patients like in the inpatient ward, for example, like when you're
Hmm.
hospitalized, that's when you would see that person. But I mean, I never liked working on the ward. I always enjoyed the clinic because I got to see my patients, I got to talk to them, and I really like following them long term, right? Because if you're in the hospital,
Nice.
you're a patient, they're hospitalized, and they leave the hospital, you never see them again. And to me, I would always wonder, like, oh, I wonder whatever happened to them,
Yeah. I
you
was gonna
know?
ask that. So I've only seen it on TV from like Grey's Anatomy. Me and my wife was like such big fans of Grey's Anatomy. And
Oh,
the one thing that stood out was they always said like don't have a relationship with the patient because like you said, they're there temporarily. It's gonna hurt your feelings that if
yeah.
even if they die on you or just whatever, mistake that you have. How are you dealing with that kind on your
Oh
profession?
my gosh. So different people deal with it different ways, but if you know yourself, if you know your personality, if you know that that's something you can't handle, or maybe you can, if you're able to kind of detach your emotions from what's happening at the hospital, then you're somebody who could work at the hospital. You could work at the ICU. Me, not that person. When I did my ICU rotation, I had friends who they would know, right? We'd have patients in the ICU, say we have 20 beds. And then there was a group of us, and I would take three patients, this person would take three patients, or however much was in there. But they would know if my patient was the one who was not doing well, I would go, I would have the family meeting. We would have like an end of life discussion. And especially if we were planning to do like a withdrawal of care, that means, it's time to remove the tube. The family, they come and say their
Mm-hmm. Ooh.
goodbye, and we allow for natural death. So I would do the conversation, I would do all of that. I would put in the orders, and then I can't be there. So I would ask one of my one of my colleagues, sorry, Travis and Carol. I think they actually had to do it for me because I got too attached to them. So that's why I know myself. I'm like, I can't be in the ICU. It's so heartbreaking, seeing people at that stage in their life, and that they're gonna be gone. And then you had to be there, you had to be strong for the family, but you're the person who's like bawling the most in the room. That's not a good look. That is not a good look.
Sí,
So
este,
I could
minus point, acá con el sabor.
yeah, well, minus a bit. Oh, what kind of doctor are you? Can you please go and cry in your car?
You see, we're trying to promote you, and then the Samoan be like, wala ko po yata.
I know. But hey,
That's good information though, because that's the only reason why I never wanted to entertain the medical side of the field, because I felt like, oh, I'm not good with blood too. I can't handle none of that stuff. With open wounds and stuff. I feel like,
oh yeah. Oh, I hear you. Yeah, when I was in the ICU, when I had to go put in central lines so people could get IVs straight into their heart, I'm not good with procedures. Like I would be the one that would be fainting. So when they knew that I was on call that night, they would be like, "Oh, Dr. Tui's on call. When she does a procedure, make sure you have some juice next to her. Make sure there's a chair behind her. Otherwise, it's yeah, but
okay,
that's why
anyways.
know your strengths, know your limitations. Ain't no shame. Find
Ain't no
something that
shame.
works for you, and that's why I'm in the clinic, and I love it. No regrets.
You heard it here, folks. You know what I'm saying? You can't be Dr. McFarley all the time with Grace, Dr. Gray. You know what I'm saying? You also need to be Dr. Tui. You know what I'm saying?
That's
We
right.
need y'all,
Right.
But
With a juice pack and a chair.
so I was just under the impression that you were just only dealing with obesity, but you're a regular doctor, so you can be a primary doctor.
Oh
Also,
yeah. On my panel.
okay, that's good. So that's the difference, folks, as you heard it here, especially to our Polynesians, man. Take care of your health. Your kids need you. You know what I'm saying? Rest in peace, Mom. My mother passed away at 60.
Oh, sorry.
So before she turned 61, she passed away. But she was a nurse. And she was well educated, all of it. It's just unfortunate that she had a heart situation, you know what I'm saying? But yeah, to our listeners out there, man, we got to take care of ourselves. You know what I'm saying? I saw more people. I think our max age is like 65. Most of us, at least. I hope that number changes, But doctor, there's so much I want to talk to you and cover, but I know you're a busy person. I just want to go ahead and give you this opportunity to close it up. If you have any closing remarks, you know what I'm saying, for the listeners.
No, I mean, when it comes to healthcare, if you are able to find somebody that you can trust, somebody that you feel like listens to you, stay with that person. But otherwise, there's nothing wrong with getting someone else, getting a second opinion, looking for someone else that you feel like you can get good care from, and who's actually able to listen to you. For direct primary care, they have it in so many different states. I think there's a directory out there that you could punch in your zip code, right? And then see if there are any clinics in the area. And I can get you that information too. I don't remember it off the top of my head.
No, that's fine.
If you are interested in something like direct primary care, like the model that I practice in. But otherwise, yeah, look, definitely, we always advocate for health. Primary prevention is always the way to go versus waiting too long and then having to deal with things when it's so advanced, right? So catching things early, that really is the key. So if you haven't had like an exam or your physical and it's been more than a year, you're due.
There you have it, folks. You heard it from the doc herself, educating and reminding us Polynesians to go see your primary doctor if you don't have one. You can find them online, right? You said, and then we're going to go ahead and post that on our description and stuff. Everything will be tagged here and stuff. But other than that, doctor, man, again, I'd like to thank you for joining us. To the listeners, I appreciate you all for always tuning in. I'm your boy Pundi Moore with Dr. Tui, and we are out, baby.
Tell me why the sky's blue. Tell me why this money is green. Now, Lord, please tell me why I do these things to make tea. Now, yeah, let me. They kick me out of church, cause I just don't listen. Always fall asleep when the preacher is preaching. Not my fault, I do love God, but on Saturday nights I be